Welcome back at 7:13. Touro earned a new certification recognizing its care for cardiac patients. It received the Joint Commission's and the American Heart Association's Primary Heart Attack Center certification. That's a mouthful there. Cardiologist Dr. Leonard Glade joins us this morning with details on this recognition and, most importantly, what it means for local patients. Dr. Glade, good morning. Thanks for being with us.
Thanks for having me.
So let's explain to the viewers out there what this certification means from the American Heart Association and the other commission there.
So I think it's important to know that Touro has gone through rigorous qualifications to achieve this standard. So our protocols are in place, our data analysts are in place, that when a patient's come into the hospital to Touro to seek cardiac care in an emergency, that we have this protocol in place to give them the quality care that they need.
So let's talk about if someone at home is experiencing a heart-related emergency, what protocol, if you will, should they go through en route to the hospital?
So first thing is if you're having chest pain, really bad indigestion, arm pain, there's some cardiac mimickers out there. I think seeking care early is important. Don't ignore it, don't sit on it. The earlier you get to the hospital, the better.
And then when you get to the hospital, what conversations, what phrases, what words should you be using with the ER staff, with the nurses on site, so people can understand this is not just indigestion, this could be something more serious?
I think expressing to them that this is new onset, that this is chest pain, that your indigestion is different in quality and nature than it was previously, that your arm pain, that's exertional, those type of things will trigger going down a chest pain protocol.
And then once that conversation's had with the emergency staff, what should that protocol look like? What should people be expecting? And if they're not seeing it, what should they be saying, like, hey, we need to be doing X, Y, and Z?
So step one when you arrive to the ER is getting an EKG. That helps us triage whether or not this is an emergency that we have to activate our team. Checking EKG, checking vitals, blood pressure, heart rates, those are all very important as you're trying to go down certain algorithms in chest pain treatment.
And anything else people need to know as they're going through this? Again, and I guess I should backtrack a little bit when I talk about symptoms, because of course it differs for men and women.
Sure.
Men are normally going to feel that chest pain, maybe the arm pain. Women, you said, is it more the indigestion that it's mimicking, or there's another symptom that you wouldn't expect, but that's what women typically experience?
It can be. I think, we used to use the word atypical chest pain, but I think we're trying to get away from that. I think really recognizing that there can be lots of mimickers out there that are not just chest pain. Indigestion's the big one. Mm-hmm. Abdominal pain too, so you can have like belly aches, nausea, and also arm pain as well.
And you mentioned that word just out of nowhere. It kind of just comes out of the sky blue, not because you ate something weird. So that would indicate that something else could be going on and you need to get to the hospital.
Correct.
Where can people go for more information on the cardiac care that you all offer day in and day out, and that got you this recognition?
So two places. One, they can go on the website, the LCMC and Touro website, and then two, talking to their primary care about seeking specialist care as well.
All right, Dr. Glade, congratulations on this recognition, and thanks for being with us to tell us about it.
Absolutely. Thanks for having me.